Start?
Okay. Mm-hmm.
Just check the patient's orders, wash my hands. I'm going to gather my equipment, come into the patient's room. I'm going to check his ID band. I'm going to introduce myself. I'm going to let him know that I'm setting up an IV. I'm going to provide him with privacy, and that's it. Let's get started. I'm going to take my IV. I'm going to open it and take it out the package. I'm going to inspect it. I'm going to be checking it for clearness and making sure that the color is correct, making sure that the IV solution is the correct one. Check the expiration date. Everything seems right. Take IV tubing. Okay, I'm going to take it out of the package. Make sure it's the correct IV tubing. Okay, I'm going to make sure that I move the clamp all the way up. It's up. And I'm going to clamp it, okay? Making sure that I maintain sterile sites, both end and top, and spike site. I'm going to come back to the patient. I'm going to check his IV site. I'm going to be checking for redness, swelling, and making sure there's patency, okay? I'm going to come back here. Take the IV bag. Make sure that I maintain sterility. What I'm going to do is take this off here, and I am going to spike the bag. Okay. Hold it upright. Okay. It's upright. What I'm going to do next is I'm going to fill this halfway. Okay, it's halfway full. I'm going to take it, I'm going to prime my line, maintaining sterility. What I'm going to do is prime it, making sure that it's clear of any air bubbles. Okay, that's done. I'm going to clamp it again. Okay. And what I'm going to do is I'm going to close it out, making sure that it's sterile. Okay. I'm going to come. I'm going to take the IV label tubing, and I am going to label and date the tube. Okay, I'm going to take a swab. Come to the patient's IV site. Okay, I'm going to take the line, and I'm going to swab it with alcohol, maintaining sterility, and I'm going to apply it onto the patient's IV port. What I'm going to do next is I am going to regulate it. In this case, we're only doing it for skills, so I am going to place it back on the drip pan, and I'm going to come over here and count my drips. I'm going to do 60 per minute. Okay. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. What I'm going to do next is I'm going to raise the patient's rail. I'm going to lower the bed, give him the call bell. I'm going to wash my hands. I'm going to record the in and out. And I'm done with the IV setting up.